Not many people understand why the Noakes Foundation thinks it's so important for us to do these interventions in communities like Atlantis. So what we're beginning to realize is that these communities are cut off from the mainstream of information, and they're forced to eat foods for which we're not really designed. And our focus is to allow people to be healthy and eat within their budget. Many people think that you have to be wealthy to eat a good diet, and that if you were poor and impoverished, you can't eat good foods. And what the Eat Better South Africa campaign shows is that that is nonsense. That we've shown that for 30 Rand a day, people can eat well.
At Eat Better South Africa, we aim to help people live better by eating better. If you look at the stats, about 422 million people globally have been diagnosed with diabetes. 600 million people globally are considered to be obese. In South Africa, these numbers are even more staggering, with about 65% of our population considered obese and 3.8 million people considered to be diabetic.
So I'm sitting here today in this beautiful garden in Constantia. And a few days ago, 3 days ago, we were in Atlantis, which is a township about an hour away from here. And the thing, it represents and symbolizes South Africa so perfectly, the dichotomy of the two places, because this is a beautiful, wealthy neighborhood where Banting in many ways began. It started in South Africa as a revolution of the wealthy. And what we realized when I joined the Noakes Foundation about 2.5 years ago, very quickly, was that it was very much that. It was something that had affected and penetrated the wealthier parts of South Africa, and none of the poor people had ever heard of it. So we set out with a quest and a dream, which was to take the benefits of the low carbohydrate revolution to the poorest in South Africa. And we had no idea what that would entail, or if it would work, or actually even if it was possible. In South Africa, the poorest get sickest first. That's directly attributable to poor lifestyle and diet. And we know that for sure. We know that in the poorest communities, children are often fed Jive, which is a cool drink, in their bottles because it's much cheaper than formula. It's also cheaper than water.
The great tragedy for South Africa is that so many people are eating so poorly that their health is affected. And they can survive like that, but then the cost to the nation is enormous in terms of lost work opportunities, frequent illness, and people are not achieving their full capacity. So the Noakes Foundation goal is to start right at the grassroots, where everyone has just ignored it. It's like we don't care how sick people are. We'll give them medication, build hospitals, train more doctors, and that's going to be the solution. But it isn't the solution. I did not know this in my training as a doctor, but I believe 85% of chronic ill health, we're talking about obesity, diabetes, dementia, and cancer, which are the diseases that really strike all our communities across South Africa. Those diseases are nutritionally based. And they're based on this diet that we're eating, which is full of sugar, full of grains and cereals, full of refined carbohydrates, full of vegetable oils. The type of foods that we've never eaten in the past. For millions of years, humans did not eat these foods. We've only started eating them in the last 50 years. And it's that period of time that has made us really ill. And so we can't treat nutritional diseases with pharmaceutical agents and drugs. The solution is to eat properly and to reduce your carbohydrate intake and to allow that to heal the body. And we've seen in all our interventions that the communities start to get healthier and they wean themselves of this need to use all these pharmacological drugs.
Ik is Henry Kloete. Ja, ik is geboren 1952. Voortvarende leven. Ja, ik heb diabetes amper oor die 20 jaar. Ik sukkel met benen trek styf, mijn arm trek styf. Mijn armen kan niet recht slapen. gaan ik hospitaal toe, gillen voor mijn pillen. Maar die pillen jaap je voor mij niet. Want dat is altijd mijn binnensteek terug.
So I'm Hasina Kaji. I'm a specialist in internal medicine. Speaking from my experience, obviously working in a government hospital, it's people who don't have access to medical aid, and that's the majority of the population of South Africa. More than 2/3 of the deaths that we saw every month were in people under the age of 65, and when you analyze that a little bit closer, those deaths, the majority of those deaths were due to strokes, heart disease, diabetes, cancer. And these are people these are people accessing the hospital from the Cape Flats. These are the poorest of the poor. These are people who are riddled with other challenges like drug abuse, trauma, HIV, and it was funny enough that HIV wasn't the cause of death in the younger population. It was metabolic causes.
Our focus as Eat Better South Africa is on the South Africans that can't afford private health care. So it's not only about people that live in townships, it's about 80% of our country that can't afford the expensive private health care in this country. We realized quickly when the foundation was conceived how important education was in this movement, and we realized that people didn't have to have incredibly heavy medical intervention to change their health. They just needed a basic toolkit, and they needed to learn the simple tools that could make dramatic changes to their lives. So off we went and we did some things, we tried out some interventions and some programs, and it changed the shape of the dietary revolution for the nation. And since then there have been well over 1,000% growth and increase in low carbohydrate eating in the poorest segments in the country.
Today we're in Atlantis. It's a cold Saturday morning when we're so excited to be here. It's week 1. Individuals will come in to get measured, to have blood tests done. We'll be measuring HbA1c, we'll be measuring cholesterol, we'll be measuring glucose, and then they will sit down for a short nutritional presentation where they'll be guided through what a healthy lifestyle entails. We're advocates of lower carbs and healthier fats, so they'll be guided on how they can adopt their current lifestyles within this framework.
The programs we've run, and this is the 10th such program, we've been able to show that within 6 weeks, people who cut the sugar, reduce the processed foods, and go to eating real foods, by that I mean dairy and eggs and meat and fish, their health starts to improve. And what I would really like to see in the long term is that instead of spending so much money on pharmacological drugs that don't help the patients, we'll be able to feed the communities properly and reinvest the money that we don't need to use for medications into those communities. So our goal is ultimately to take one community in South Africa and to change the whole community. We're not sure which community it'll be, but maybe it'll be Atlantis. Maybe in the next 4 or 5 years we'll find a donor somewhere that says, fine, I see what you're trying to achieve. Let's do it in one community.
We've run 10 self-funded interventions so far, and we want to run another 1,000 in the next years. So we can't get there alone. It takes everyone that could possibly help, that could possibly be involved. So we would love to hear from anyone that wants to come and be involved, wants to fund an intervention, wants to talk to us about how they can get involved and support the program.
It's been an amazing experience working with all these communities because they're such impressive people. And it's so wonderful to see them embrace these ideas and to realize that there is a way out of ill health. And that way is to eat properly, to eat real healthy foods. And the Noakes Foundation and our Eat Better South Africa campaign are just so excited to be able to help so many South Africans to see a better future for themselves.
I would encourage everyone to stick to this diet. This morning I took my blood sugar levels Now I said to my wife, when I get there, I'm going to tell him it was 7. She said, yeah, that's how I'm winning with him, and no, it was 7.9. I said, okay, fine. But for the first time in a long time, people, do you know what my blood sugar level was before I got with this intervention? 20.6.
Most of my clothes didn't fit 6 weeks ago because, you know, you gain weight slowly and eventually nothing fits. So I had something like 4 shorts and 3 t-shirts that fit, and I wore one every week. it's been something else. I've lost almost 8 kgs.
That's incredible, man.
And the health aspect is really good. It's awesome, and I'm looking forward to seeing where this journey will take me.
It's time to open your eyes and realize we all human, the essence of love. We all chosen for this path, this life, this road. Truth spoken, don't wait. Let's make the peace date. You and I are light in the darkness. Light in the darkness, it's who we are. You and I are light in the darkness. Light in the darkness, it's who